Hello friends, hope you're all okay. You're all enjoying your life and you're also enjoying watching my videos. I'm Dr. Arshad Nadeem Awan with my ultrasound and radiology teaching video. Today I'm going to discuss about the basics of the CT brain images. CT brain anatomy, and how we will understand and how we will appreciate all these structures which we can see on the CT brain. I will start with the reconstruction images, how many types of the CT brain we have, plain, non-contrast and contrast CT images. Then I will particularly discuss about the axial plane and the sagittal plane and the coronal images. So after that I will explain about the anatomical structure, the gray matter and the white matter, why it appears hypodense and hyperdense. So all these information would be included in this video. I will explain particularly about the anterior cranial fossa, the posterior cranial fossa, the middle cranial fossa and their boundaries. Particularly discuss about the pituitary fossa, the hypothalamus, the lentiform nucleus, the caudate nucleus, the basal ganglia. All these would be included in that video. After that, I will also explain the cerebrum, cerebellum, and the cisterns and the CSF floating. All these would be included in this video. This would be quite useful video for the medical student, for the radiology residents, and for the clinical practitioners as well. So I do hope you will benefit from this video. So keep watching my video. So let's start looking for these images. This will include all that useful information. So let's start the video. There are mainly two types of brain scanning and brain CT scanning. The one is with contrast and another one is without contrast. In this image, this is the CT brain without contrast. Without contrast scanning should be performed in case of any trauma or any contusion or any injury or any brain hemorrhage. So this is usually used in the setting of acute trauma. This image is a brain CT with contrast, and the main purpose of with contrast brain CT is to detect the inflammation, the trauma, the tumor, or any leakage or destruction into the blood brain barrier. If there is enhancement, it means that the blood brain barrier has been broken due to any reason. There is another usage of contrast CT brain, and that contrast is usually specially used in intrathecally through the lumbar puncture. Contrast has been injected into and waiting for the few seconds to let these contrast flow through the CSF and to the brain, to the ventricle, and following the cisterns. So that is also called as cisternogram. This is basically used to look for any CSF leakage, any site of the CSF leakage from any of the defect or from any paranasal sinuses if there is any leakage. So this defect can be detected through intrathecally contrast injection. However, the usage is quite limited. CT scan survey can be done through three images: the axial plane, the sagittal plane, and the coronal plane. Here on this image you can appreciate the axial plane and the sagittal plane. So far the original planes and original images are concerned, these are axial plane and these are unprocessed images. If you want to have the sagittal plane or coronal plane, you have to have the thin slices construction. So the computer will reconstruct it and it will reorganize that in the form of sagittal and in coronal views. Normally the machine cannot make the sagittal planes and coronal planes. It will only provide you the axial plane. So machine cannot itself provide you the sagittal and the coronal plane. Here on this image you can appreciate this is the coronal plane. So these three planes are important for the study and the survey purpose. Brain is composed of gray matter and white matter. Here on this image you can appreciate towards the right that the gray matter which appear as a brown, and it is undulating and it is outer surface of the brain. That's why, because it is composed of mainly nerves. So far the white matter is concerned, it is the deep part of the brain, and it is mainly composed of axon and myelinated nerve going from the cortex. Cortex is called as gray matter as well, which is going from the cortex to spinal cord and connecting both cerebral hemispheres. Here on the CT image you can appreciate that the outer undulating surface, which is gray matter, appears to be slightly whiter. It is less dense. However, in the middle area where the white matter is, it's appear to be darker because of the axon and myelinated nerves, which are composed of fat. Fat is less dense than the soft tissue and water. Water and soft tissue density is almost the same. However, slightly different. Soft tissue density is slightly higher than the water, but we may consider it as a water and soft tissue density tissues are the same. So on this image, if you appreciate, the gray matter is dense, which is outer surface of the brain, and the white matter is less dense. That's why it is called as hypodense, and it is the middle or center of the brain. This is the magnified view for the understanding purpose. You can appreciate that there is a yellow line which is covering the outer surface of the brain, that is pia matter, and then again there is another red line which is called as arachnoid matter, and then the most outer layer which is called as the dura matter. This pia matter, the yellow line, it is actually adhering to the surface of the brain. However, you can see the arachnoid matter, which is the outer coat, and in between the arachnoid matter and the pia matter there is a space which is called as subarachnoid space, and this subarachnoid space is particularly for the CSF. So this blue area and the blue color is denoting the CSF. Now come to the outer surface, that is a dura matter. Dura matter happens to be a very thick layer, very dense layer, and it is actually a fibrous tissue and keeps the brain in place. Even it decreases movement when we swing our head around, so that's why it's a very thick dense layer, and it line the outer table of the brain. While pia matter and arachnoid matter happens to be a very fragile layer, and these both together would be considered as a leptomeninges. You cannot separate these both from one another, and in between these both there will be CSF fluid floating. Another point worth noting here, that the gray matter is arranged in a form of projections. Look, you can see these projections invertedly. These projections are called as gyri or gyri, whatever you want to pronounce that. Multiple are collectively called as gyri, and only one is called as gyrus. They have their own particular name and they have their own anatomical location, and the space between these two gyri are called as sulci. So there will be multiple gyri and multiple sulci on the outer surface or on the outer part of the brain. One another point worth noting here, that in the arachnoid or subarachnoid space, these small tiny yellow projections can be seen. Actually, these are veins, and these veins are called as bridging veins. So you can note these bridging veins as well on the image. Here is another magnifying view for the better understanding. On that image you can appreciate the gray matter and the white matter. Gray matter happens to be white in color, and white matter happens to be dark or hypodense. On this image you can appreciate sulcus, and you can also appreciate the gyrus. Sulci are actually the grooves, and the elevated or the bridging part is called as a gyrus. In between these both you can appreciate that the CSF is floating, and this CSF is the area where the CSF is floating in between, that is called as subarachnoid space. Cranium is divided into three compartments: the anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa. And there it contains different lobes. There is a brain stem which has three parts. So from inferior to superior, it is comprises of medulla oblongata, which is continuous with the spinal cord. The next comes is pons, which is on the top of the medulla oblongata, and on the top of the pons there is a midbrain. So this is what the anatomical structures we are going to appreciate on the CT scan images. This diagrammatic representation explaining the anterior cranial fossa. Anterior cranial fossa is confined between the frontal bone, that is anteriorly frontal bone, and from the posteriorly it is great wings of sphenoid, or in other word it is also called as sphenoid ridge. Now look for the middle cranial fossa. Middle cranial fossa is anteriorly confined by the sphenoid ridge and posteriorly confined by the petrous part of the temporal lobe. So far the posterior cranial fossa is concerned, anteriorly it is confined by the petrous part of the temporal board, or it is also called as, and another is basi, occiput, or clivus. So these both parts are demarking the posterior fossa, and posteriorly it is confined by the occipital bone of cranial ward. In between all that there is PF, which is denoting pituitary fossa. This diagrammatic representation shows that we are at the lower part of the cranium, where the medulla oblongata starts and where medulla oblongata then unite with the spinal cord. Here you can appreciate this is what the posterior fossa, and posterior fossa is surrounded by anteriorly clivus, and from the sides petrous part of the temporal bone, and posteriorly occipital bone. Medulla is in the center, and we are at the lower part of the cranium. Now we are moving slightly high. Here you can appreciate there is a cerebellum, and then there is pons. So on the top there is a pons, and down there is a cerebellum. In between these both there is fourth ventricle lies. Again I would say that posteriorly that bony projection where you can see in the image, this projection, bony projection, is continuous with the fibrous structure of the dura, and that separate both cerebellar hemisphere. This is called as falx cerebelli. So falx cerebelli you can call it as well. So this is a dural fold, dural structure, fibrous structure, which is separating both cerebellar hemisphere. Here on this image you can appreciate the posterior fossa, you can appreciate two cerebellar hemisphere. There is a dense bone which is called as petrous part of the temporal bone. Anterior to that petrous part of temporal bone there is a fibrous, thick fibrous tissue, you can call it septa, and this fibrous septa separates cerebellum from the cerebrum, and also separate the posterior fossa from the rest of the cranial cavity. And this fold, this structure is called as tentorum cerebelli. So tentorum cerebelli is attached to the petrous part of the temporal bone. So here in this image, this green is called as tentorum cerebelli. So for the revision purpose, here you can appreciate there is pons, and there is a cerebellum, and then in between the cerebellum and the pons there is fourth ventricle. In view, you can also appreciate the temporal bone. Just have a look to this image and you can appreciate that there is cerebellum on the posterior aspect, and then there is a tentorium. So tentorium cerebelli you can also see. There is a brain stem. Brain stem is the most superior part of the brain, midbrain. So midbrain, you know, it is comprises of three: the top brain stem, and then pons, and then medulla oblongata, which we have already discussed and we have already seen. In this view you can appreciate the temporal bone, and we have already gone up from the pons, so that's why this brain stem is visible to us. Frontal lobe you can appreciate in this image. You can also appreciate to some extent Selvian fissure, and you can appreciate the temporal lobe in this image. As we move forward and upward, things start getting more complicated. Here in these two images you can appreciate two frontal lobes, the right frontal lobe and the left frontal lobe. A sphenoid ridge, the site for the sphenoid ridge here you can appreciate, which divides the anterior cranial fossa and middle cranial fossa. This is the line of demarcation between the anterior cranial fossa and the middle cranial fossa, and the middle cranial fossa is comprises of temporal lobe. There you can see the right temporal lobe and the left temporal lobe. Just behind, in between, you can appreciate the brain stem. Brain stem is composed of from down to upward medulla oblongata, pons and midbrain, and furthermore downward you can appreciate a two cerebellar hemisphere. So these two cerebellar hemisphere is these are in view. On this particular image I'm gonna try to explain the sulcus, a prominent sulcus which is called as central sulcus. Anything anterior to the central sulcus would be frontal lobe, and posterior to the central sulcus would be the temporal lobe. Now in this image you can appreciate posterior to the parietal lobe there is a small occipital lobe is visible. So how we will differentiate that this is the central sulcus and we will differentiate it from the other sulcuses? So you have to go up towards a more superficial slice, and the only sulcus that continues to the midline would be the central sulcus. So everything which is lying anterior to the central sulcus would be frontal lobe, and anything lying posterior to the central sulcus would be the parietal lobe. Only the central sulcus reaches the midline, and anterior to it everything would be anterior or frontal lobe, and posterior to it it would be parietal lobe. Just immediate to the central sulcus there will be anterior gyrus, and posterior to it there would be posterior gyrus. Here on this image you can appreciate that the frontal lobe is much larger and bigger. That's why we are called as an intelligence being, intelligence creature, because we have a cognitive behavior. We can dream, we can think, we can develop, we can do everything. That is because of why? Because that we have a larger brain, larger frontal lobe. So this frontal lobe is responsible for all these cognitive behavior and the developmental thing. So that's frontal lobe differentiate us from the other creatures, from the animals and from the other creatures. So as we growing older our brain gets atrophy, and as like the other organs of the body, the bones it becomes osteoporotic and osteopenic, and muscles becomes atrophied, and hearing loss and vision loss and hair loss and so many other things happens with the passing age, and every system of the body gets deteriorate, so that the brain also get deteriorate, and it causes volume loss because of the aging process. Here in this image you can appreciate there is a brain of 10 years old and there is a brain of 90 years old with a marked difference. On the 90 years old you can see that the sulci they have become larger as a result of like the gyri, which as the basic components are become smaller, ventricles are large, and that is why because of the loss of volume as compared to 10 years of age, where the sulci are not larger, not prominent, and gyri are the thick. So these are the sign of the aging, these are the sign of the brain atrophy. Here on this image again you can appreciate the normal brain, the 10 years old brain, and the 90 years old brain, where you can appreciate that there are larger sulci and smaller gyri in the 90 years old patient, and there is a larger ventricles as compared to 10 years old child. Because of why? Because of the reduced volume or brain atrophic changes. In other words, you can call it an extra and intracellular spaces enlargement. So that is mainly the reason of the brain atrophy. However, we can not reduce or prevent the brain atrophy, but we can slower down the process of the brain atrophy by developing by introducing ourselves to new skills and new intelligence and learning things. As like if we go to the gym and we develop the muscles, so we just put the pressure on the muscles, we use the muscles, as a result it gets bigger. Same the brain is like, if you keep on studying, you keep on learning, you keep on learning new skills, so you may be able to slower down the process of atrophy and process of the aging. On this image you can again appreciate the normal volume of the brain and the volume loss, and you can see that the gyri are very small in atrophic brain, and sulci are quite bigger. Here you can appreciate one more thing, that is the central sulcus, which is approaching the midline, and in the center there is a falx cerebri, and you can see this one of the central sulcus approaching or reaching to the midline. Anterior to it there is a precentral gyrus, and posterior to it is a post central gyrus. So here on this images you can appreciate the central sulcus. Now this is the slice where the ventricles are over, and in the image you can appreciate the fibrous tissue line which appears white on the normal CT images and has been shown green on the other image. This is actually falx cerebri. This is very thick, very strong septum, and it is responsible for preventing the brain from the excessive movements. Now here on this image we are going to discuss about the coronal images reconstruction. Here you can appreciate both right cerebral hemisphere and the left cerebral hemisphere, and posteriorly you can appreciate right cerebellum and the left cerebellum. In between these two, these both are cerebellar or cerebellum, divided or separated by the tentorum cerebelli. So here tentorum cerebelli can be easily seen, and this is remain continue with the falx cerebri in the midline. So you can appreciate that there is superior sagittal sinus on the top of it, where all the blood from the brains drains. So on this image you would be able to appreciate the tentorium cerebelli, which separate the cerebrum from the cerebellum, and also you can appreciate falx cerebelli, and beside this you can also appreciate on the superior most part, that is superior sagittal sinus. Here again we back to axial images, and on this axial images you can appreciate a very big sulcus or big fissure, and that is at the lateral aspect of the cerebral hemisphere, and this is called as Salvian fissure. Salvian fissure actually it separates the temporal lobe from the rest of the brain. So anterior to it there would be either frontal lobe or parietal lobe, and below to it this would be a temporal lobe. So between these two cerebral hemisphere on the top you can appreciate falx, which would be called as a interhemisphere fissure. there is a fissure which is continue with the falx, and falx can be seen, so that fissure would be called as interhemisphere fissure. You can appreciate both anteriorly and posteriorly. There is an area deep to the Selvian fissure which is called as insula, and on the normal brain specimen you would not be able to see insula because it's very deep, it's a buried area, and if you remove the overlying brain then you will be able to see the insula, and it is covered by the frontal lobe, part of the frontal lobe, part of the temporal lobe, and part of the parietal lobe. The area that the parts which is covering the insula is called as operculum. So there would be a frontal operculum, there will be a temporal operculum. Here you can appreciate this on the superior, this is a frontal operculum, and the posterior, this is a temporal operculum. However, you cannot appreciate this parietal operculum on these images. This image has been taken from a slightly older age group, that's why you can see that the Selvian fissure is prominent. In between these two cerebral hemisphere, this CSF filled area is called as third ventricle, and just beneath that posteriorly there is a occipital horn of the lateral ventricle. So you can appreciate on these images the Selvian fissure, and in between these two cerebral hemisphere, this part CSF filled space is called as third ventricle, and posterior to that these two these two posterior horn of the lateral ventricles are visible. Beautiful explanations of the density on this slide. Whosoever made this slide, hats off for that. So here they mention that density means whiteness. On the CT brain we use three terminology: the hypodense, the hyperdense, and the isodense. Hypodense is the area, is the black area, so this would be called as hypodense. It's normally CSF would appear hypodense, and the abnormally infarction area would also appear hypodense, and some perilesional edema like abscess, it will also appear as hypodense. The next comes is hyperdensity. It's mean the bright white. So normally found in the brain, so brain would be a hyperdense, and calcification would also be hyperdense, but abnormally hemorrhage will also be hyperdense. As far as isodense is concerned, it is the color in between the black and white, and normally brain matter also appear as isodense. One important rule they have mentioned here, that anything white in the brain CT scan would be either blood or bone. So let's have a look to this cross-sectional images. On the top left side you can see the scanogram. You may call it scout, or you may call it as surview. So this is always on the upper left of the film. So next to that, this is the inferior part of the brain, and here on the scout you can see the thin lines. Each line represent a particular slide. At the base of the skull, slices are usually thin, and for the rest of the brain these slices are comparatively thicker. On the very first image you can appreciate C1 and the dens of C2. The maxillary sinuses are visible, the postnasal space and the nasopharynx is visible. On the third image you can appreciate the medulla oblongata and tonsils of the cerebellar hemisphere, and you can also appreciate the foramen magnum. While on the fourth there is a medulla and bilateral cerebellar hemispheres can be seen. On the sixth image you can see middle cranial fossa, and it's containing the temporal lobe. So as you go a little higher, so some other images will show you the further reconstructions. So here on this first image you can appreciate the petrous part of the temporal bone, and then middle cranial fossa, which is filled by the temporal lobe of the brain, and these first two images showing the round structures in the middle, this structure is pons. When you got up, this round structure changes its shape, and it convert into the midbrain. So in the next slices you can see the midbrain. So medulla oblongata, pons and midbrain has been shown on these images, and these are the part of the brain stem. If you go slightly up, the midbrain join the cerebellum or cerebral hemisphere. There is a falx cerebri, and you can appreciate the sylvian fissure, and you can also appreciate the insula. On these images you can appreciate the dura. You can also falx cerebri is visible here, and you can also appreciate the central sulcus, which is approaching to the mid part. So this is these slices where we have discussed all these important components of the brain, which can be easily appreciated on these images. And then you have also noticed about the scanogram, or you can call it a scout, you can call it a surview. So now we are at the most inferior level of the skull, where the foramen magnum is. Here you can appreciate this is the foramen magnum, and this is contrast enhanced CT. On this ACT you can appreciate internal jugular vein, common carotid arteries, and here within the foramen magnum, these small two white dots are the vertebral arteries. So these vertebral arteries are surrounded by the spinal cord and the lower part of the medulla oblongata. They unite at the pontomedullary junction to make the basilar artery. So this level is called as cervicomedullary junction. So because here the cervical area and the medullary area unites together to form the cervicomedullary junction. In the view you can appreciate the nasal symptoms, and the maxillary sinuses are available, and you can appreciate the maxillary sinuses. Here on this image you can appreciate these two white dots comes close. These were vertebral arteries, and now they are uniting to form the basilar artery. Here you can appreciate the medulla, and in the view the cerebellum, right cerebellar hemisphere and the left cerebellar hemisphere is visible in this image. These two white dots are disappear, and it is become now basilar artery. This one white dot is visible, and you can appreciate this on the contrast images. It is anterior to the pons. So basilar artery, posterior to basilar artery, there will be pons, and there is a cerebellum. So in between the cerebellum and the pons there is fourth ventricle. Here on that image you can appreciate the petrous part of temporal bone, which is separating the posterior fossa from the temporal lobe. So there is a temporal lobe. Sella turcica is also visible. Orbit and eyeball can also be seen in this image. Sella turcica, which is also called as pituitary fossa, and where the pituitary gland sits. Here in this image you can appreciate the sella turcica or pituitary fossa, and in the next images you will see there will be a suprasellar cistern. As we go slightly up, so you see that petrous part of the temporal bone is not seen. It's mean that tentorum cerebelli is over. So when tentorum cerebelli is over, it's mean there is no cerebellum. So here on this image you can appreciate the midbrain. Midbrain can be seen here. Posterior to the midbrain there is a tiny dot which is called as cerebral aqueduct, or it is called as sylvius as well. It is located above the sella turcica or suprasellar cistern. So this is where you can appreciate on that part. Root of the pituitary gland is visible, which is called as infundibulum. So here the root of the pituitary gland can be seen, and this is called as an infundibulum. On this image multiple cisterns has been explained. Look to the most posterior one. It is called as quadrigeminal cistern, and then on anterior to quadrigeminal cistern there is a midbrain. and then there is a suprasellar cistern. But if you closely look between these two peduncles, so there's a small area that is called as an interpeduncular cistern. On the top of it, it's a suprasellar cistern, and then you can appreciate this infundibulum. There's a very thin white line which connecting the pituitary gland to the rest of the brain, and this small thin line is called as an infundibulum. Here again you can appreciate on this image there is infundibulum, this wide thin line, and there is suprasellar cistern is visible in this image. You can also appreciate the midbrain, and posterior to midbrain there is a quadrigeminal cistern. So posteriorly and anteriorly you can appreciate the rest of the structure of the brain. Here again for the better understanding, you can see the midbrain, and then quadrigeminal cistern is visible, and then suprasellar cistern is visible, and also you can see infundibulum. So this slide shows all these structures quite clearly. Once again have a look. This is occipital lobe most posteriorly, and there is a midbrain, and between the midbrain and the occipital lobe this small black dot is cerebral aqueduct. You can appreciate the parietal lobe here. Suprasellar cistern is visible, infundibulum where the pituitary glands connects with the brain, and there is a frontal lobe. However, you can appreciate the sphenoid ridge which separates the frontal lobe from the parietal lobe and temporal lobe. But the Selvian fissure is the one who separates the temporal lobe from the parietal lobe. So slightly higher, you can appreciate here the third ventricle is visible. On both lateral sides of the third ventricle there is thalamus. So then you can also appreciate in view the quadrigeminal cistern, and there is midbrain visible on this particular image. Again, for the repetition purpose, you can see that frontal lobe is there, and Selvian fissure which separates the temporal lobe from the parietal lobe. Here the parietal lobe you can appreciate in view, midbrain is visible, and quadrigeminal cistern can be seen, and occipital lobe which is the most posterior part, you can see this occipital lobe there. On the top the frontal lobe is visible, so the frontal and occipital is on the top and back, and the rest of the structures can be seen in this image. Here on this slide I'm going to talk about the basal ganglia, which is mainly composed of gray matter, and because they contain axon, that's why it is composed of gray matter. The component of the basal ganglia, here you can appreciate that the lateral walls of the lateral ventricle shows the caudate nucleus. Here you can appreciate this blue in color is a caudate nucleus, and caudate nucleus having its head, body and tail. On the most lateral aspect you can see this brownish one is called as a lentiform nucleus because it looks like a lens, that's why it is called as a lentiform nucleus. So posterior to that the another important structure lies, which is called as thalamus. In the green color you can appreciate the thalamus. So look for the non-colored images. Here you can appreciate the caudate nucleus, and then you can appreciate the lentiform nucleus, and you can also appreciate the thalami. Dark space between the caudate nucleus, the lentiform nucleus and the thalamus is the area which is called as internal capsule. So internal capsule having its limb, so that is anterior limb which is posterior to the caudate nucleus and anterior to the lentiform nucleus, and there is genu, and then there is a posterior limb. Posterior limb is posterior to the lentiform nucleus and anterior to the thalamus. If I specifically talk about the lentiform nucleus, it has two parts. More medially towards the medial, a small part is called as globus pallidus, and the outer lateral part is called as a putamen, and together both this is called as lentiform nucleus. Lentiform nucleus joins the caudate nucleus by the very thin lines, striations. These connect the caudate nucleus with the lentiform nucleus, and these striation called as corpus striatum. These together called as a corpus striatum. So the area of the quadrate nucleus and the lentiform nucleus together, this is called as corpus striatum, because small striation connecting these quadrate nucleus with the lentiform nucleus. So together both they collectively called as corpus striatum. Here on the images you can appreciate this posterior to the thalamus small calcified part. This is actually choroid plexus, which appears calcified. On this slide, this would be a sort of repetition, and this is a superior image. Here you can appreciate the frontal horns of the lateral ventricle. The caudate nucleus is visible. The basal ganglia can also be seen, and there is internal capsule quite visible. So posterior to the internal capsule there is thalamus. You can appreciate the occipital horn of the lateral ventricles. So these structures can be seen on this diagram. Here on this image, this colorful image and this color scheming shows the caudate nucleus head, and you can also appreciate the lateral ventricles anterior horn. You can appreciate putamen and also internal capsule. You can appreciate the thalamus. Posterior to the thalamus there is hippocampus, and just laterally you can appreciate the lateral ventricles of the posterior horn of the lateral ventricles. In between, in the midline, there is a pineal gland. Pineal gland is usually calcified, so you will quite often see calcification on the midline. That would be because of the calcification of the pineal gland. So on this scheming you can appreciate the basal ganglia. You can also appreciate its different structures of the internal capsule, its anterior limb, its posterior limb, its genu, and in the center there is a third ventricle visible as well. So on the surrounding sides you can appreciate the sylvian fissures as well. So this is what this beautiful colorful diagram indicates, all these important structures which you can appreciate. Again a slightly higher image, you can appreciate the lateral ventricle, and there is just beneath that there is a caudate nucleus visible. You can also appreciate the basal ganglia. In the basal ganglia component, internal capsule and the thalamus and the caudate nucleus is quite visible. Third ventricle is visible. The choroid plexus can be seen in the posterior horn of the lateral ventricle, which is usually calcified because of the choroid plexus. On this image you can appreciate the sylvian fissure, and the third ventricle is visible, and the occipital horn of the lateral ventricle can be seen quite clearly on this image. A midline structure, corpus callosum, can be seen here, and it has four parts. The first is rostrum, and the genu, and the body, and the splenum. Here midline structure you can see the genu of the corpus callosum is visible, and there is also splenum of the corpus callosum is visible. Internal capsules can also be seen. Anterior limbs and the posterior limbs of this internal capsule can be seen on that image quite clearly. Have a look to this image, and this is the superficial slide, and frontal lobe is visible, and you can appreciate the caudate nucleus. The basal ganglia can also be seen with the internal capsule V shape with the anterior horn above straight line and posterior horn below the straight line. So this can also be clearly seen. In the midline, the third ventricle is also visible. Thalamus can also be seen posterior to the lateral horn of the internal capsule, inferior horn of the lateral capsule. So there is a pineal glands. Normally it is not calcified, but normally it's calcified, and in view the occipital lobe can also be seen. A sort of repetition, so the frontal horns of the lateral ventricle, and underneath there is a caudate nucleus. The basal ganglia is visible, indicating this lentiform nucleus, and you can appreciate the internal capsule. It's posterior to the horn. The third ventricle can also be seen there. Thalamus are visible, and occipital lobe is clearly identified. Internal capsule, that's anterior horn and posterior horn, and its central structure is also visible on this image. In this image, the frontal lobe is visible, frontal horn of the lateral ventricle can be seen, the caudate nucleus is visible, and here thalamus in the view can also be seen. The calcification of the choroid plexus within occipital horn of the lateral ventricle can also be seen. Occipital lobe is seen, falx can be seen. So this was a concise and the basic study of the CT brain, and I do hope that you would be able to get some information from this video. Please keep sharing this information with other students, medical student, radiology residents, and those who are practitioners, so this would be quite useful for them. And keep watching my videos, keep sharing, and subscribe to this channel. Thank you very much all.